And what is the relationship between persistent pain and an opioid use disorder?
So I think there is a huge overlap, and I'm definitely not the first person to say this, between persistent pain and opioid use disorder. And a lot of the things that we focus on improving and addressing and treating persistent pain is going to be there are going to be similar interventions of what we're going to do to help with that opioid crisis as well. On the flip side, there are some things that are maybe a little bit more specific to persistent pain, and some things that are a little bit more specific to opioid use disorder. Some of those things would be just even kind of when we talk about individuals with opioid use disorder, specific things on how they manage those medications. But going back to the similarities, if we can, persistent pain is a main driver of why sometimes people use opioids. And I think around 75% of people who are struggling with opioid use disorder did have a medical prescription for opioids at one point in time. So there's that pain component definitely plays a large role with that. And the better we can get at addressing persistent pain, which sometimes is a very challenging diagnosis. I know it's not just one diagnosis, but many diagnoses. But when we have someone who has a really persistent pain state, oftentimes described as like a nocioplastic type pain state, those things are challenging to treat. And that can kind of sometimes lead into that pathway of opioids because it's such a powerful agent that when people don't know where else to turn, that could be a pretty significant thing for people to consider.